Okay, another case for you. This is a case that I posted on the Keep Cerecing Facebook page. Got kind of an interesting response from a couple of individuals, so I thought I ought to go ahead and plug this in and give a little more data about what happened and what we did. So this is a patient. Obviously, she's got a lot of issues with her teeth. Multiple carious lesions, advanced periodontitis. She honestly hasn't seen a dentist much at all in her life. She said it had been more than 10 years. Anyway, given her situation, we always give our patients the choice. We talk about what's going on from the standpoint of health and periodontitis and tooth decay, and where do you want to start? What do you think would be your priority? But I always recommend starting with, just like I was trained in dental school, my priority is treating active infection or sources of pain. Periodontitis is an active infection. Tooth decay is an active infection, so we have to triage and recommend treatment based on what we feel is most critical. So for her, my recommendation was, number one, we have to start with periodontitis, because she was, just active, horribly inflamed. No tooth pain to speak of, aside from what we'd already taken care of. You can see a crown over here. I recommended starting with the largest lesions, the largest carious lesions. So that was 8 and 9. She desperately wanted to straighten her smile. One of the reasons she came into the practice was to talk about Invisalign. Honestly, in her current state, that's not really an option for her. So not until we get things taken care of. So we opted to go ahead and do her a favor, help her out as much as I could. So she did her best to scrape together the money to pay for crowns on 8 and 9 with core buildups. And so I went ahead and did 7 through 10. And I told her in the process we could look at straightening those teeth the best we can. So here's a little further back view, another view of the same. Here's her incisal view. You can see definitely some crowding and rotation there. Significant issues going on with her smile. Here it is. So we got her all numb and we went in and prepped the teeth. I did my best here to prep these teeth so that they wouldn't end up being exposed, having the pulp exposed. My worry was if I over prep this on the facial too much to accommodate more of a straight profile there, then I'd end up having a pulp exposure and we have to do a root canal. So my goal was to be as conservative as I could, but allowing us to accomplish our goal of doing at least some straightening. Now, one thing I should mention, and you can see this very clearly, is the height of the gingival contour here. It's obviously not going to be straight. And I prepared her for that, having done this a few times. I wanted her to know that, even though we're going to straighten your teeth, when you smile and lift that lip up, you're going to see these uneven gum lines, So she was ready for it. She was prepared. So same picture here, a little bit closer view. Same thing. Facial view. A little bit of recurrent, significant amounts of decay were removed. We have a little bit of remaining stain is what I should say. And I did go ahead and open this. There's not quite enough space here. We need to have a little separation there. But you'll notice I didn't use any cord. I don't criticize or fault anybody that does. Cord can make things so much easier in some situations. I am comfortable and have done this, personally. This is how I do it. I don't normally use the cord. I just use viscostat or ferrous sulfate to go ahead and, create some, stop the bleeding. And if I need cord, I'll use it, but it's been a long time since I used any cord. So here's the post-op. You can see, and these are CeraSmart. You can see the gingival height is different. It's uneven. Let me go to the next one here. One of these is, there we go. Gingival contour is uneven. It's not quite ideal, but for what she wanted and what she could pay for, I think this is a great result. You can see, on 7 and 10, this is number 7 because we're looking in a mirror and it's upside down. So 7, and you can see down here. Facially, there's a little bit of a bulge there, which is right here. There's that bulge there, and there's a little bit of one there. And then because of the position of, the lingual preparations here in an attempt to not expose the pulp or get too close. You can see we're getting close in a couple of spots. There are some little bulges here on the lingual, and I prepared her for that as well. She has no active contact on her anterior teeth. So this is just paper from me pulling the paper out when she was biting on it. The paper kind of scraped that and left a little mark. Anyway, the case turned out really, really nice. It was a good opportunity to serve. And like I said, this was not an ideal case. I certainly don't feel like orthodontics should be eliminated from the dental practice. A lot of times, having a machine that can make same-day smiles in one appointment, we joke about not needing an orthodontist, but totally that's a joke. I actually employ an orthodontist in my office, and so that's an important and valuable piece of the dental diagnostic process. So good outcome for this patient. I followed up with her the next day, and she's doing great. She has never contacted with these teeth. Even here, there's she's got some overjet there. So I've also here got the design process. I'm going to go ahead and put it on double or even quadruple speed so you can watch the design process. Quintuple speed, and I'll kind of narrate as we go. This was an opportunity again to serve a patient in a way that we wouldn't necessarily have been able to without having the Cerec technology in the office. You can see me here trimming the modeling, and then the first thing I do is I'll marginate, of course, like everybody does. Now, I was trained, and I feel like this still pretty much applies. If you're ever in doubt as to where the margin is on a crown, you always want to have the margin too wide. That way, if and when we go in and do some adjusting on the margin, we are sacrificing the crown margin rather than the actual tooth structure. So the margination itself, pretty straightforward. I could have gone back and reduced those a little bit more, but I didn't feel the need to. So the computer gave us a decent proposal to begin with, and as she watched me design this, she literally was like, "Wow, that's awesome," compared to what she had. I did not take any a biocopy scan, a pre-scan. I didn't feel the need necessarily with just 4 teeth and the fact that we weren't going to replicate anything. So a little bit of design work. I always start from big to small. Position the teeth where you want them to be. If you're going to do any scaling, do the scaling. Then make sure your minimal thicknesses are appropriate. You can see she's got a significant overjet there, so we didn't really have to worry about contact. Here I'm altering some of the thicknesses. You can see the computer proposed design number 7 as a veneer rather than as a crown, which is interesting. And then I'm changing the thickness there with the smooth and the add and the subtract tool. So really this design process with 4 teeth didn't take too long. I want to say it probably took me 10 minutes or so. I guess I could look at the length of the video. I think the whole thing was 16 minutes, but some of that was dead time. But great case. I think she was very, very happy with it. Here's me checking the contacts. I like with my contact design to compensate for some of the thickness or some of the polishing that will happen with a little bit of extra thickness. So you can see here I'm just creating a little better contact control. And then I went in and used the incisal, or now they call it the facial variation tool. You can see those linguals are still a little bit tough there, a little bit thick. So here's the facial variation tool. Let me move my face out of the way. You can see me popping through those variations. I usually end up having it expressed at about 20 or 30%. It's not a huge amount of expression. Let me just back up a little bit since we're to the point where we're going to mill. So you can see the the mamelon effect there and the facial variation. I usually, like I said, I express it generally depending on how much the adjacent teeth have it expressed naturally, but usually it ends up being between 20 and 30%. So she ended up with a great smile, good opportunity to serve. I am glad that I've got the training to be able to do Cerec. And honestly, when you've done it quite a bit and you have a good team that can walk you through the process and support you as you do it, it's really helpful. So another great case, I'm here at Dentsply Sirona World. I'm getting some good education today. In between breakout sessions now. But I'm going to be picking up some great information on airway management, obstructive sleep apnea, and also looking at getting a CBCT machine. So that'll be fun. We saw a great presentation from T-Bone Agarwal doing a same-day immediate load implant placement with a hybrid restoration. Really cool stuff. He's amazing. Also saw Dr. Aaron Elliott talking about sleep apnea and incorporating that into the dental practice. So hopefully, as I bring some of this online, I'll be able to share some of this information to you as we bring it online in my practice. So anyway, thanks for watching.